Thank you, Modesto. All right, we'd like to start our Joint Committee of Commerce and on Human Services today, April 6th. I understand that the state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Health emergency. City council committees are currently meeting remotely. We are using Microsoft to make these remote hearings possible, and instructions for how the public may view and offer public testimony at public hearings of council committees are included hearing notice that are published in the Daily News and Legal Intelligence prior to the hearings, and can also be found in phlcouncil.com. I now that the hour has come. McMonigal, please read this is a joint commerce and economic development and public health and human services committee regarding resolution number 10201. Mr. McMonigal, will you please read the title of the resolution?
Resolution 101, a resolution the committees on commerce and economic development and public health and human services conduct a joint hearing to review the past and current guidance on restaurant capacity, and, if needed, make recommendations to the Philadelphia Health Department. We have Dr. Thomas Farley, and Michael Rashid, Commerce Director.
Mr. Chairman, do we want to take roll first?
We're just going to get started first. We'll have roll right after the first testimony.
Okay. Chairs, are you ready for me to go?
Yes, Dr. Farley. Just state your name for the record and proceed with your testimony.
All right. Thank you. Good afternoon, Chair, school ambassador, members of the Council Committee on Commerce and Economic Development and the Committee on Public Health and Human Services. My name is Dr. Thomas Farley, and I'm the Health Commissioner for the City of Philadelphia. I appreciate the opportunity to provide testimony regarding the occupancy of restaurants in Philadelphia. I'll give testimony for the entire administration, and Commerce Director Mike Rashid will be with me to answer your questions. While we are all tired of the COVID-19 virus, the virus is not tired of us. The epidemic has already killed more than 3,200 Philadelphia residents and continues to kill between 25 and 30 more every week. Our case rates from COVID-19 today are extremely high, with more than 500 residents diagnosed with the infection every day. Case rates have approximately doubled in the past 5 weeks. More than 100 residents are newly hospitalized with COVID each week. The number of people being treated in Philadelphia hospitals has more than doubled since early March. While I'm hopeful that vaccination will ultimately tame the epidemic, it is clear that we have not vaccinated enough Philadelphia residents to stop the spread of the infection yet. There's no question that restaurants are high-risk sites for transmission of COVID-19 virus. The evidence to support this conclusion comes from several sources and several types of studies. To mention just a few, it is well established that COVID-19 is spread through the air and that the site of entry is the respiratory tract. That means the highest risk situations are those where people are near each other, indoors, not wearing masks. That's exactly what happens when people dine at restaurants. In many states, restaurants are the most commonly identified healthcare setting for COVID-19 outbreaks. A CDC study published last year found that going to a restaurant, bar, or coffee shop was the highest risk community exposure for COVID-19. A national study done last year using credit card data, found that states with more restaurant spending had more rapid increases of COVID-19 cases. A study published in the scientific journal Nature that modeled the epidemic in 10 large cities, including Philadelphia, identified full-service restaurants as the most important settings for COVID-19 spread. The New York Times did a study that showed that states with greater restrictions had fewer COVID-19 cases per capita, and restrictions on restaurants and bars were particularly important. And a CDC study published in March found that counties that reopened restaurants had increased growth of COVID-19 cases and deaths from COVID-19. At the same time, we recognize that restaurants are an important part of the economy of Philadelphia and that they provide tens of thousands of jobs for Philadelphians. While the safest approach to COVID-19 would be to keep all restaurants closed for indoor dining, we have worked diligently to create new regulations and guidelines that allow restaurants to have indoor dining with important restrictions that are necessary to keep people safe. As you know, in Philadelphia today, all restaurants are allowed to serve customers to eat indoors up to 25% of their maximum occupancy. Because COVID-19 is spread through the air, dining outdoors is safer than dining indoors. and increased ventilation should reduce the risk of spread of COVID-19. A few months ago, Vice Chair Dom argued to me that restaurants should be allowed to increase this capacity to 50% if they could demonstrate that they had a high level of ventilation. I thought this was a good idea, so working with Commerce and obtaining advice and input from a group of restaurant owners, we developed standards for high levels of ventilation and a streamlined process for restaurants to demonstrate that they meet these standards. Those that do are allowed to increase their capacity to 50%. Note that we will not eradicate COVID-19 virus in 2021, and we may not eradicate it for years or ever. That means we will all benefit over the long term if all restaurants have high levels of ventilation indoors. It is my hope that the difference in allowed capacity tied to these ventilation standards will encourage all restaurants who do not currently meet these standards to upgrade their ventilation systems. I know that through the efforts of my colleagues in the Commerce Department, the city has provided tens of millions of dollars in relief funds to restaurants. While I understand the great need that restaurants have to use these funds to cover basic expenses, it is my hope that, paired with the relief from the Commonwealth and the federal government, many restaurants will choose to use some of this funding for ventilation upgrades. The Department of Health will continue to monitor case rates, hospitalizations, and deaths in order to determine the best policies for restaurants. As vaccinations increase, we hope that COVID case rates and deaths will fall. If they do, we intend to increase allowable occupancy in restaurants. But it is necessary for us to remain flexible. New information and unforeseeable factors make it difficult to predict or plan very far into the future. Thank you for the opportunity to testify. I'll be happy to answer any of your questions.
Thank you for your testimony, Dr. Farley. Before we go into questions, we'd like to go into call a roll for attendance, and then we'll go to Mr. Rashid, and then we'll go to questions after that. Mr. McMonagle, please read the, please call the roll.
Councilmember Squilla.
Present.
Councilmember Bass.
I am present. Thank you.
Councilmember Gim.
I am present. Thank you.
Councilmember Heenan.
Present, Mr. Chairman.
Councilmember Gilmore Richardson. Councilmember Green. Councilmember O.
Present.
Councilmember Curtis Jones Jr. Councilmember Gautier. Councilmember Brooks.
Present.
Councilmember Dom.
Present.
Councilmember Johnson. Councilmember Thomas.
Present.
Thank you all. Mr. Chairman, we have a quorum.
Thank you, Arg. Quorum is present, and we'll continue with the hearing. Before we ask any questions, Mr. Rashid, would you like to just state your name for the record and proceed with your testimony?
Can you hear me, Mr. Chairman?
Yes, we can. Thank you.
Okay. Thank you. Michael Rashid, Director of Commerce, City of Philadelphia. Just a few comments, Mr. Chairman, and then I'll be happy to take any questions that you may have. I just want to summarize some comments that we have made to other committees of City Council over the past few months. First of all, what has the Commerce Department, with the backing of the mayor and the Health Department and city government, done over the past year to support restaurants financially or otherwise to be able to open safely? First of all, we just want to make sure that we call everybody's attention to the fact that the hospitality industry was the most hard-hit industry of the COVID pandemic. In the past year, just in Philadelphia, over 37,000 individuals lost their job as a result of the COVID pandemic. Most of those people were lower income women, and most of those people were lower income women who are Black and brown in our society. So, we talk about the restaurants, which are businesses, which are very important businesses, but they're more than businesses. They are also major employers of low income Black and brown people in our community. And to the extent that they are, it's like a stone in a pond. It ripples out into childcare, education, general income, and many other things that are ailments in our society. And so it's more than just trying to rebound some business owners when we talk about the restaurant industry. We're talking about thousands of people, low-income people in our society who are adversely affected by what happens to this industry. With that in mind, over the past year, the Commerce Department distributed 10,000 PPE kits at the start of the pandemic to restaurant employees and to restaurant owners. We work collaboratively with the Health Department to get business feedback on the Reopen with Care campaign to help businesses safely reopen. Of the $13.3 million distributed through the Small Business Relief Fund, approximately $4.7 million was distributed to food businesses. Of the $12 million through the Restaurant and Gym Relief Program, nearly $10 million was provided to restaurants. Working with PIDC on a $17 million program called the CHIRP program, which is the Commonwealth Hospitality Industry Relief Program, we are actively soliciting restaurants to apply for those funds. So far, we have over 600 restaurants that have applied for those funds. We're looking for more. We'd like to be able to double that by the deadline of April 12, 2021. We're working interdepartmentally with all departments of our city government to adapt our regulations and to update and communicate guidance and to provide more options for safe dining. I have to say, because of the number of jobs that have been lost, this is the number one job loser in our community. Commerce Department and the whole city has been really working harder than any other. This is our top priority, working harder than any other area that we're working in to try to restore those businesses to a safe level in which they can employ their people and to be able to serve the public. So I'll stop right there, Mr. Chairman, and take any questions that you may have.
Thank you, and appreciate your testimony. Before we go further with questions, just to read that the witnesses we have for today, everyone who's been invited to the meeting to testify should be aware that the public hearing is being recorded. Because the hearing is a public, participants and viewers have no reason to expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for comments and witnesses, I will note for the record at this time that we will use the chat feature available on Microsoft Teams to allow members to signify that they wish to be recognized in order to comply with the Sunshine Act. The chat feature must only be used for this purpose. All right, thank you. Now we'll go into questions. My quick question before we go to other council members. Instead of asking for specifics from the industry, Dr. Farley or Commissioner Rashid, do you see a timeline that you expect, say, increases in occupancy levels or other things that will change within a certain timeline? I know we changed number of vaccines and when people will get vaccinated. So now that we see that and we know the 19th, it's going to be open to everyone. Does that change anything in your mindset, or are we looking at certain factors before a decision can be made?
Thanks for the question, Council Member. So there's a lot about this epidemic that's frustrating, but the most frustrating aspect of it is how unpredictable it is. I expected that this virus would follow the pattern of other respiratory viruses, which tend to be at their worst in January, and would get better in the spring, and then be at the low point in the summer. But we are experiencing a new epidemic wave right now. Not quite sure why, but it may very well be that the variants of the virus are at heart there, and so it's making things worse. And so with all that uncertainty, I am very reluctant to make any kind of predictions. We have said in the past that the governor allowed increased capacity restaurants on April 4th. We said we were not going to do that, but we said that we would consider it on April 30th if case rates were falling. And I can't be more specific than that. I'm hopeful that we have more people vaccinated on April 30th. I'm hopeful around that time we start to see the epidemic on the decline, maybe because of the high levels of vaccination. But there's so many, I've been through so many times when this virus has surprised us that I can't predict with any certainty at all that that would happen.
All right, but now that we know, obviously, that a prediction of maybe vaccines, will we reach 50? Do we project to reach 50% of vaccines by a certain time? Are we looking at a certain number where then that makes you feel comfortable?
Right. My best guess is that by around April 30th, we may have 75% of people over the age of 65 vaccinated, and maybe as many as 50% of adults vaccinated. And when I say vaccinated, I mean with at least one dose. But again, there's plenty of surprises. If case rates are continuing to rise at that point, even if we have the many vaccinated, then that means that that's not enough. With new variants taking over, it may be that that's not enough. And maybe we need to have higher levels to make a difference. So I'm hopeful that things will look better at that time because we'll have that many people vaccinated. But I'm just very reluctant to make predictions.
Okay. Councilmember Dom, you have a question?
Yeah, thank you, Mr. Chairman, and good afternoon, Dr. Farley. I just wanted to clarify something about the air restrictions. And I think we had a conversation maybe 2 or 3 months ago about how we could get increase from 25%. And we talked about airflow and nothing specific, but, could you measure air or whatever? And I'm no scientist or doctor on that. But I guess the issue we are seeing now from our restaurant people, and you're going to hear this today, is that the requirements that the city put in place for the airflow seem to be we're the only city in the United States that has this requirement. And I think that's what you're going to hear from them today, that they feel that requirement is overreaching. Now, I'll let them speak for themselves, but that's what it appears to me. I don't know any other city that has the requirement that we put in place. So I think that's what you're going to hear from some of the testimony today. So I just wanted to clarify that and share that with you.
Yeah, so I'm not aware of other cities that have that. On the other hand, I do like the idea. We all cities feel much more comfortable with outdoor dining than indoor dining. And what's the difference? Well, outdoor dining, there's lots of very good ventilation. They said, well, if we could have very high levels of ventilation indoors, then restaurants could have the economic benefit of people working without having the risk. So I very much like having an incentive for restaurants to have high levels of ventilation. But to be clear, there are other cities that every restaurant is at 25% capacity. Washington, D.C., for example. And so you might say, compared to them, there's more of an opportunity in Philadelphia than there is elsewhere. And also, I put in my testimony the idea that we're going to have to live with this virus for a very long time. And so I very much want all of our restaurants to have good ventilation. That'll serve all of us well over the long term. And so having some differential density tied to ventilation provides an incentive, which I think will help the whole industry upgrade its ventilation, and then we all benefit from that. So even if we were to increase capacity, I would want to still have some incentive there for that ventilation. And then the incentive is tied with the availability of funding now to install it.
I think it is difficult for several smaller restaurant operators to install this system based on the cost. And I think that's what I'm hearing. But you're going to hear in the testimony today, but I just want to give you kind of an update.
Yes, thank you. If I could just mention on cost. So we did, as you know, put out a list of ideas on how they could meet the standards. And some of them can be fairly expensive, upgrading your entire HVAC system. But some of them could be a few $100s. Particularly when the weather is warm, a fan in the window can provide this level of ventilation. And I don't know what kind of financial support restaurants are getting now from the federal government. I hope it's a lot. And I hope that they can peel off some of that to do some sort of upgrades. Thinking of this over the long term. This is not for the next month or two, but over the next 2 years, that improved ventilation will serve everybody well.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Council Member. I also forgot to mention our co-chair of the Health Committee, Councilmember Bass, for a comment or question.
Thank you, Mr. Chairman. I have a question for the, primarily I think for the Commerce Department, for our Director, Mr. Rashid. And I guess what I wanted to know is if you have with you today or can get for us additional information about what's happening in the neighborhoods. You were very gracious to go on a tour with us on North 22nd Street and also other parts of the 8th District recently. And one of the things that you'll notice, and we talked about, was the lack of restaurants. And so the restaurants that are in our neighborhoods, are really, really in need of support. So I was wondering if you had or could break down and get to myself and my co-chair information in terms of where those resources went in the neighborhoods. Sometimes it feels like when we're talking about restaurants, we're really just talking about Center City restaurants. And while there's no question as to the importance of the Center City restaurant scene, which I do enjoy myself, we also have to make sure that we take care of our restaurants in the neighborhoods, because when things are happening in Center City, when tough times come to Center City, it's really tough in the neighborhoods. And so I was wondering if you could talk a little bit about that in terms of where those dollars went in our area, or could get us that information.
Councilwoman, I can get you that information, but you make a great point. You're absolutely right. For various reasons, there is much more data available in terms of what's going on in Center City than there is in the neighborhoods. And so that's a priority of ours, is to get better data. I will get you data on what you're asking for. Please let us follow up with you and get you that data.
Thank you. And I appreciate the recognition that gathering data on the restaurants in the neighborhoods is important. So I'm looking forward to getting that and working with you on that. Thank you, Mr. Chairman.
Okay.
Thank you, Madam Chair. Are there any other questions from any council members to commissioners? All right. Thank you, guys. If you could just hang in there for a couple follow-up questions, we appreciate it. We have Mr. McDonald will read the list of the next people testifying, and if we have to come back, maybe we could ask you a couple questions. So, Mr. McGonigal, please read the next panel.
Yes, can we please have Melissa Bova of the PA Restaurant and Lodging Association, followed by Avram Hornick from Four Corners Management, and then followed by John Myro from TRIA Hospitality Advisor Group member.
Okay, thank you. If we want to start out, Melissa, if you want to start first, and then we'll go in order. Just state your name for the record and proceed with your testimony.
Thank you, Councilman. My name is Melissa Bova. I'm from the Pennsylvania Restaurant and Lodging Association. Councilwoman Bath, Councilman Squilla, members of the Public Health and Human Services and Commerce and Economic Development Committee, thank you for allowing me to testify today about the experience the hospitality industry has had relating to mitigation standards put in place by this administration during the COVID-19 crisis. PRLA has been extremely involved in every aspect of this crisis at the state and local level. And as the Vice President of Government Affairs at the PRLA, I can speak to the differences between different localities in the state and how those differences have impacted this industry. We have worked hard at the state level with the governor's office to develop clear guidance across the Commonwealth, and we worked with state and local officials to pass legislation to help the industry get through the past months and hopefully future months. The last year has been terrible for restaurants, hotels, and caterers, and we hope that by highlighting our frustrations today, we can move forward in bringing this industry back to the vibrant contributor to the city's economy it once was. Further, you will see the testifiers here are not only restaurants, but also hotels and caterers, because the impact of these standards is much farther reaching than just the restaurant industry. At no point will we deny the steps that needed to take place over a year ago to protect the citizens of Philadelphia. Our industry shut down because it was the right thing to do to keep everyone safe and for health officials to determine how to best get a handle on this pandemic. What we do have issue with is the way the administration targeted our industry this past fall and most recently in the past few months. The administration has voiced concerns about private gatherings in people's homes being the biggest spread of COVID. And these gatherings were taking place entirely because our industry was forbidden to operate. Yet, despite us not being the cause of the spread, additional standards have been put on restaurants specifically just to reopen at 50%. There are members of the Restaurant Advisory Committee here today to speak specifically to their experiences as members of the committee and operators within the city. But I did want to highlight a few key points that have been proven true over the past few weeks. The current HVAC standards that are in place are not in existence anywhere in the country. I have reached out to a number of my counterparts in other cities and states and asked why they don't have a similar model. They said it was impossible to have a standard that all restaurants of all sizes, of all types, could comply with. The health department had said at the beginning that these standards could be something that others in the country could replicate. We are 8 weeks in, and no one has chosen to replicate these standards. We, quite frankly, begged the city not to implement these HVAC standards for restaurants to operate at 50% and not make it a requirement, but make it a strong recommendation. As Dr. Farley said, to incentivize people to use their grants to make these investments, but don't pick winners and losers by making it a mandate. The city declined. We further asked, as Councilman Squirrely, you just mentioned, for a timeline. So those that can't meet these standards know when they can go to 50%. The city has declined to provide us any type of timeline, any type of hope for this industry to be able to operate at 50% without the extra expense or standards put in place with these HVAC requirements. That's likely been the most frustrating piece of this for us. We don't know when the end is going to be because nobody's giving parameters of when the end will be in sight. The city stated to us that some businesses were choosing not to go to 50% just because they didn't want to. Of the 6,000 restaurants in the city of Philadelphia, 1% have applied to increase to 50%. The vast majority are in Center City, and the vast majority are part of larger restaurant groups or chains, which once again has proven our point that minority-owned, independent small businesses are not able to increase their capacity and are stuck operating at 25%, which in this industry is a death sentence for them. So those who have suffered the most are not able to increase their capacity. We are now, as I said, almost 2 full months into these standards, which have not changed, while other cities are at or above Philadelphia's current parameters. I know Dr. Farley mentioned Washington, D.C. We love to compare ourselves to New York City. New York City is at 50% for indoor dining. Boston has a 6-foot social distancing rule between tables, and Chicago is currently at 50% capacity. And none of these cities have the standards that Philadelphia has in place. Restaurants continue to suffer because they are being targeted as a spreader of the virus when they aren't even open or allowed to operate. I do want to acknowledge that during this process, the Commerce Department, Commissioner Rashid has done his best to act as an intermediary between the health department and the industry. But we are 13 months into this crisis. The vaccine is being distributed and the industry cannot suffer any longer. It is time Philadelphia aligns with the rest of the state of Pennsylvania, or at least at minimum its surrounding states and cities, and allow private events to be held in our establishments, allow restaurants to serve guests safely and at higher capacity, without onerous, expensive requirements put on them that every other state and city in this nation has determined makes absolutely no sense. Thank you for allowing me to testify today, and I'm happy to answer any questions.
Thank you, Melissa, for your testimony. According to, you're saying no other people have the ability to do the ventilation in their city or have a regulation in place to do the ventilation in their city. Is there a ventilation, and I know Dr. Farley mentioned a fan and other things, is there something that you can do that would work as an industry?
There's nothing that can be uniformly applied to the industry. For example, Dr. Farley mentioned you could put a fan in a window. If you are a business that's in a basement, you don't have windows. Or if you are a restaurant in an old building, your windows might be sealed shut. You don't have the option to do that. So the problem we have is that for some businesses, there might be a more affordable option, but it's not available to all businesses. And that's why this regulation, this requirement, picks winners and losers, and especially requires those that can't do the simple, affordable piece to operate at 50% because it's just impossible.
Okay. Commissioner Rashid, do you have any other ideas on what you think may work as an addendum until we fully open?
No, I was looking for Melissa's cell phone number because I was going to send her a text and tell her I thought she did real well. I mean, she did good. So I mean, no, I'm sorry, I don't. And this is the predicament that we have.
Right. Okay, so either we change the requirements for what is necessary for indoor dining, or just most people will not be able to do it, is what you're saying.
No, and she makes the point, which is very true, that 6,000 restaurants, and they're all over the place. I mean, there's some that are in basements, some that are very large, multi-floor restaurants, you know, and so it's difficult. I mean, I don't disagree with Dr. Farley that given where we are, ventilation is important, and it will help. And there's studies to prove that. But it's very difficult with so much diversity in restaurants to be able to come up with a set of standards that you can reasonably expect everybody to be able to meet. It's very difficult.
Okay, thank you. Thank you so much. We'll move on to the next testifier.
Mr. Chairman, I have a quick question. It's Bobby Heenan.
Go ahead, Councilmember.
Thank you for the recognition. And my question is going to be more towards Melissa and our Commerce Director. And thank you for all who were attending today's hearing. So, Chairwoman of our Health Committee, Councilmember Bass, had talked about data sets, and I know that the PLRA has had a lot of surveys amongst their members, but I want to state for the record that it's more than just members. It represents an industry. Is that correct? Melissa, you're on mute.
I apologize. When we do surveys, it's not just limited to our members. Obviously, our members respond more, but it's broad-based surveys across all facets of the industry in all parts of the city. So it is representative of the industry within the city of Philadelphia at large.
Okay. So the question to the Commerce Director, if we can, Mr. Rashid, when we collect data, are you able to separate commercial quarters and standalones, multi-level buildings or to pair anyone who has a liquor license or restaurant license?
The Commerce Department does not collect that. For example, the grants that were recently given, we do have demographics, racial demographics on those grantors. But there's a lot of data that, for example, that the Health Department does collect. I don't think that they collect racial demographics on some of that data.
Okay, so racial demographics, the equity would certainly be a part of the data collection, which I think is extremely important. I'm talking about, in addition to the locations of some of these businesses that have restaurant licenses or liquor licenses. I know some are BYOB, but more of the demographics of locations. Are they commercial quarters? Are they standalone? And are they multi-story buildings? Or as Melissa said, there's some that may not have ventilation that are in a basement or a warehouse setting. I'm just so the question is, when you're taking a look at some of the equity numbers and when it comes to disbursements of some sort of grants and low interest rate loans, could you also take a look at the demographics of the type of business, the location, the square foot of the business? Would you be able to coordinate with and collaborate with the health department?
Yes, that would take some coordination, but that, quite frankly, that's our job in the Commerce Department, is to coordinate that. I think that would be some of it would be in L&I, some of it would be in the Health Department, and that's our job. Again, we'd be happy to try to collect some of that information and present it to you.
Okay, great. If it's not too much trouble, it'd be great if you took lead in that and trying to coordinate with because it is the Commerce and Health Department committee hearings here today. It would be extremely beneficial because that will give us a snapshot of the types of businesses, the size, and the locations, on our corridors. Are they standalone? Are they center city? Who has reached the level of investment of the higher HVA system? I don't know anybody in my commercial corridors in my district that has self-reported to a higher ventilation requirement, and that's their decision. But those, that information is telling. So I appreciate your time and thank you.
Okay.
All right, thank you for your question, council member. I'm not sure who was next. Was it our
Can we have Avram Pornick, please?
Yes.
Yes, thank you. Thank you, members of council, for allowing me to testify today. I'm here on behalf, as a member of the Restaurant Advisory Committee, to express the frustration that we've had with dealing with the health department. We'd like to thank the Commerce Department and the Streets Department, who've been very cooperative and kind of open to our input. But we've had consistent issues with the health department. Now, all of us realize that that the city officials are choosing between the lesser of two evils. Certainly, if we lived in a world different from our own, it would make sense to everyone to stay in their homes until the pandemic subsided. But that's not what happens in the real world. So we look at it as clearly when the pandemic first happened, it was a red light. All restaurants should close. Once we reach enough vaccinations, it should be green. The restaurants should open. But now we're kind of in the gray area. And this is where we hoped we could help contribute to doing things safely. And we really expected the health department to come to us on the Restaurant Advisory Committee to ask us questions on how we can achieve safe restaurant operations. And that's not what happened. During this entire time, they haven't asked us any questions. They haven't asked us for our help. We've constantly made suggestions to them. We've written memos, we've written reports, and we get the same answers back again and again. Oftentimes, even the Commerce Director, he cited the study from Nature and the credit card studies. All those studies have to do with restaurants at 100% occupancy. The same study which he cites also says that when restaurants are at 50% occupancy, that the spread of the virus is only 10% of what it is at 100%. So I think that we want to have the dialogue with the health department about ways restaurants can open safely, but realizing that there's sometimes when they can't open safely. And that's where we need imagination. We need creativity during this gray area where in some things we do, if we do them differently, we'll make it safer. But realizing that these things are still going to be somewhat unsafe. But a lot of these studies are also talking about this substitution effect. That when you close restaurants and places of public gathering, that forces people to substitute gathering in private homes. And what these studies have found is when they substitute a highly regulated, properly designed restaurant setting to a private home, that actually increases the spread of the virus. So simply saying and creating rules, but not taking into account that there might be a substitution for unsafe behavior by closing restaurants, they really need to weigh the factor of those two things, which they're not doing. And I think more importantly, we've asked the health department to include a frequently asked questions on their website. There's so much confusion among restaurant operators on what they're allowed to do, what they're not allowed to do, what's safe, what's unsafe. And what we asked is to have a simple frequently asked questions that could apply to all restaurant operators equally. But instead, they say just call us or email us individually and we'll answer you individually. That doesn't make much sense. It has to be a standard applying to all restaurants equally across the city. And I think it's very important to understand that if you look at the case rates between Pennsylvania versus Philadelphia, they're both going up, right? In the same proportion. But Philadelphia has a 25% dining, Pennsylvania has a 50% dining. Nevertheless, our cases up and down match the rest of Pennsylvania. We're not any different. So that goes to show that it's not restaurants occupancy which is causing the spread of the virus. It's other factors. So we love the opportunity to have a dialogue with the health department, for them to come ask us questions as operators, as people who understand the way people act, to come to us and help us provide a safe way of opening. Their air ventilation standards, it's untenable. It does not work. It's not possible to turn an existing HVAC system to get more air exchanges than it's designed to do. So I appreciate your opportunity to testify today. And all we ask is that during this gray zone, that we have the opportunity to help make the city safer and allow restaurants to open in a safe manner.
Thank you, and understand your concern. And maybe Melissa or somebody knows. Do we know how many restaurants that took advantage, or maybe Michael, of the circulation regulation, air circulation regulation?
How many have met the standard?
Yeah.
I do have that. Melissa may have it faster than me, but I do have that. As of March 25th, 135 restaurants have been approved for expanded capacity.
Out of the 700, is that?
No, it's estimated 6,000 restaurants.
I meant 7,000. Yes. Yeah. So 6,000 restaurants.
Yeah.
So it's a very, very small percentage.
Yes.
And Councilman, we do have a map that we put together I can share with you. The vast majority are in Center City. The vast majority are part of large restaurant groups. And the vast majority are white-owned restaurateurs.
Okay, thank you. Obviously, that's a problem. Mr. McMonagle, who's next to testify? Was it Randall? Whoever was next, just state your name for the record and then proceed with your testimony.
Hi, I'm testifying. This is John Myro from TRIA. Good afternoon, Chairman Squilla and members of the committee. I own TRIA Restaurant. We have 2 restaurants that are presently open and 1 in the process of opening. And I was on the Restaurant Advisory Committee. And I'd like to specifically address the enhanced ventilation program. Of course, the goal of improving restaurant ventilation is admirable, but the program is deeply flawed. And I think it's important to know that the health department itself touted this effort as being unlike anything being done anywhere else. I think there are good reasons for that. Melissa's already stated that as of March 25th, there were either 120 or 135 restaurants certified, 2% of the restaurants. 2/3 are considered independent restaurants, so not casinos or hotels. So that's only 80. And then I'd say all but 20 are owned by larger groups with at least 5 or 6 restaurants in the city. So very few smaller operators without deep pockets have taken advantage of this program. So there's something bigger going on here. The important question is, why have so few restaurants taken advantage of this program? Well, there are 2 ways to get certified. You can either self-certify or you can hire a professional. So I want to address the notion of self-certification. The health department claims that any restaurant owner has the ability to self-certify, and therefore there is no need to hire outside professionals. My own experience, both as an operator and as a member of the committee, shows otherwise. If you're actually able to follow the instructions, the first problem is that the results aren't going to be accurate. The health department is asking lay people to measure their buildings' air changes per hour and percent outside air. I ran this thought by our exhaust ventilation contractor. He's a mechanical engineer and is accredited by the National Balancing Council as a certified test and balance supervisor. I didn't know there was such a thing either, if you're wondering what that is. He told me that performing these calculations correctly requires specialized equipment, and that holding a measuring device just 1 inch in the wrong direction could render incorrect results. He reviewed the health department's measuring guidelines and found that one of their equations, as well as their recommended measuring device, to be incorrect. The health department actually visited one of my locations to perform calculations on air changes per hour, and their results were very different from the mechanical engineers. The bottom line is if this process is to be taken seriously, it needs to be performed by trained professionals. The second issue happens is what if the measurements don't meet the guidelines? Only a trained professional would know what steps could be taken to improve the ventilation to achieve the standards. Only a trained professional would know what steps, or would know that in certain cases, an establishment simply wouldn't be able to meet the guidelines. After spending hours in meetings with the health department, hours talking to this mechanical engineer, and hours doing my own research, my takeaway on this whole issue is do not try this at home. None of us on this call are able to do this as lay people in this very specialized field. So in order to meet the guidelines, I hired this professional. And again, he wasn't begging to take my money. And many other restaurants hired him and perhaps other professionals as well. I paid $1,200 for the 3 restaurants. There are other expenses I incurred as well. And for Tria, it was worth the expense considering how small our restaurants are. I know it's very important to the city and the Commerce Department stated this, that this be a level playing field for all types of restaurants with different resources. It's simply not. So you might be wondering why I'm here, because I'm a beneficiary of this program. I have 3 restaurants out of the 135 that are allowed to serve at 50% capacity. I'm here because I felt like I needed to speak up for a few reasons. One, I think this program appears to be a waste of the city's limited resources and our city's restaurants' limited resources, given how few restaurants are certified and given that the ones that are self-certified may have inaccurate measurements. 2, the health department did not even want to disclose which restaurants are certified. We had to fight for that. I don't understand why that would be a secret. How would a guest even know which restaurants actually meet the guidelines if they're not publicized? 3, the restaurant owners I've spoken to honestly just don't think this program makes any sense. And there are people out there who see this as an invitation to flaunt the rules. I can say with absolute certainty that my fellow restaurant owners are beyond frustrated. 4, if public health improvement and protection is the main goal, then I would advocate enforcing existing standards and force the bad actors out there to either change their behavior or close their businesses. It's incredibly frustrating for me to see nuisance bars do whatever they want and act practically as super spreader events while I'm hiring an engineer to measure my air changes per hour. The health department claims there is adequate enforcement, but the anecdotal evidence shows otherwise. 5, even as the state has relaxed dining standards, including an increase to 75% indoor capacity, Philadelphia didn't even relax minor standards that guests really don't like having to order food with a drink, or not being able to dine inside with one's immediate family of 5. I have a family of 5. I am not allowed to dine in my own restaurant, even though I've spent thousands of dollars and many, many hours trying to keep a safe environment. When the state relaxed its guidelines on April 4th, the city didn't even bother to relax minor regulations such as these that have no direct correlation to public health. Philly is about to embark on a campaign to welcome people back to the city. But when restaurants enforce rules that don't exist anywhere else, we're the ones that look like villains when we tell people no. And people might think twice before coming back to the city from the suburbs. I believe that every member of the health department I've met is well-intentioned, highly competent, hardworking, and truly wants to make Philadelphia safe. But I also believe that my industry has been targeted to an extraordinary event and that the desired results could be much better achieved with a different approach. Thank you very much for this opportunity to testify. I appreciate it.
Well, thank you for your testimony. And as you say about the bad actors, we as, allowing certain things to happen as far as outdoor dining, the streeteries, do you see that as easing some of the stress, the ability to do that, or not everybody's able to do that either?
The streeteries you're referring to?
Yeah. Yes, the streeteries.
The streeteries have been the one amazing, wonderful thing that I think the city has done for our industry in the pandemic. It's been, sure there are countless restaurants that owe their present survival to the streeteries. And two of my restaurants, the ones that stayed open, I don't think I'd be here on this call today if it weren't for the streeteries.
Okay, thank you. I know Councilmember Bass, you have a question?
Not a question, but I just wanted to make a comment, which is that I wanted to echo the gentleman's statement regarding enforcement for bad actors. The lack of enforcement that we've received through the health department, and I don't mean to put anybody on the spot, but I do need to put people on the spot in terms of we need help. We need help in our neighborhoods. And a lot of the bad actors in the 8th District, we repeatedly requested support from the health department and have not gotten the level of enforcement, which has allowed them at the height of the pandemic to act as super spreaders. You would go by and see a very small space crowded with, lots of people most of whom were not wearing masks. And so you just knew that the results are going to be catastrophic for this particular community. And it wasn't one shop or one store or one restaurant or eatery. It was, a number of places that we were trying to get enforcement on. So I just wanted to echo that sentiment because I've seen it firsthand. We've experienced it firsthand, and we're continuing to work on the enforcement need. So thank you, Mr. Chairman.
Yeah, and I agree, Madam Chair. Also, and even with L&I, we had some people that, do the right thing and apply for the permit to get the streeteries. Then we have other people don't do anything, just put them out there and they build them too much into the street. They block, and we had, incidents already where people run into them. So, we need to do a better job. We don't want to throw the baby out with the bathwater, and we want to keep these opportunities open. But then we have to be able to enforce the bad actors, or everything's going to go to waste. So we appreciate your input and comment. Mr. McMonagle, do you want to read the next panel to testify?
Yes, can we please have Claire Cardy from Kaleidoscope Weddings, followed by Jeffrey Miller from Jeffrey Miller Catering, Ed Gross from the Greater Philadelphia Hotel Association, and then J. Nathan Basil from Woody's Bar.
Hi there.
Yeah, Claire, just state your name for the record and then proceed with your testimony.
All right, great. Hi, everyone. My name is Claire Cardy, and I am the owner of Kaleidoscope Weddings and also a venue in Center City, Philadelphia named View on 50, which was fortunate enough to open in April of 2019. So I actually wanted to start off by thanking everybody for allowing me the opportunity to testify. I am speaking on behalf of both the planning company and the venue because I think it's very important for the two perspectives to be heard. First and foremost, the venue, View on 50, which opened, as I mentioned, in April of 2019 and had to shut its doors. Essentially on March 6th was our last event of 2020. We have had a very, very difficult time, and I think it's very important, and I am so happy that Melissa has brought us into this conversation because while a lot of the conversations have been revolving around restaurants and restaurateurs, which my husband is as well, so we've had a very, very fun year. It's very important for everyone to understand that the catering groups and the other groups in the hospitality industry have been extremely hard hit by the mandates enforced by the Philadelphia Department of Health. First and foremost, and something that I know, probably isn't spoken about, we have to often deal with very, very unhappy couples, clients, some of which have brought in lawyers and lawsuits because we, as the venues, are unable to keep up our end of the contract and the ability to host their events. I actually had a very unfortunate call yesterday with yet another couple who is unhappy because they were supposed to get married in March of May of 2020, and has rescheduled to May of 2021. And after the most recent guidelines that Dr. Farley, put out, basically, they told me that they wouldn't be able to have their event at our venue and need to get married elsewhere, and therefore need all of their money back, which I don't have, because despite the wonderful EIDL loans and PPP money, it's just not enough to keep a business afloat after a full year of being closed. That is the business side of it. Now, from the couple's standpoint, and this is something that I feel very, very strongly about, the only thing that the city of Philadelphia is doing is driving these couples to other places to have their weddings. So while the city of Philadelphia has put these mandates and indoor catered events and indoor catered venues are at 0% capacity, these couples are then going to other locations outside of the city of Philadelphia, to surrounding suburbs, to other states, such as the state of New Jersey, New York. And most recently, and this is where the planning side comes in, because we have clients that are really from basically everywhere. We actually had 2 clients, one of which canceled their wedding completely in Philadelphia and has moved the entire wedding to Florida, since half of the guests are from Florida and half are from Philadelphia. Another group who canceled their wedding entirely and moved the entire wedding to Utah for the same reason. So it kind of doesn't make much sense, since these folks who are living in the city are now just traveling outside of the city limits, having their events, coming back to the city. All that it's doing, all that these mandates are doing for us is not giving us the opportunity to help. And I think that's the biggest sort of slap in the face from us as business owners. We want to have some stake in the game. We want to help. We want to open our doors. We want to be part of the solution. And right now we're just unable to do it. And therefore these events are happening. They are either happening at private residences where, rules and mandates are thrown out the window, or they're going to other cities and other states entirely where the restrictions are much more relaxed. So I think that's our biggest gripe. That's my biggest gripe. And it's something that I think is super important for us all to be able to understand. Thank you again for your time, and I will welcome any questions or comments.
Thank you, Claire. I'm just going to say that I, too, had witnessed that. I've actually attended a couple weddings, none in Philadelphia, but going to those other areas and understanding all those people. Matter of fact, one wedding was over in Jersey. They rented school buses to take everybody in, which is even worse. Yeah. You're pushing everybody onto a school bus, taking them over to Jersey, go to a wedding, and then everybody comes back. And it is a challenge, obviously. So we need, and Delaware, I've been in a wedding in Delaware County also. It is a challenge, and we need to do better. And my thing is we have to find ways. There has to be ways that we can make things done safely and be able to do it in a way, because like Dr. Farley even said earlier on the call, you don't know different variants after a vaccine if something happens. So if we have different variants coming in and the vaccines don't seem to work for different things, do we just stay closed forever, or do we figure it out now how to do these things safely and then work through this process, especially now when the cases are up and they're going to go down in the summertime. This is the time to test these waters and find out what we can and cannot do. We appreciate your input. I know for the record, I want to say that Councilmember Green is present.
Thank you, Chair.
You have a question?
This time, may have a question a little bit later, but I'll come back.
All right, thank you. Claire, thanks for your testimony. Jeff, do you want to state your name, and then we'll have Ed and Jay follow you. State your name for the record and proceed with your testimony. Jeff, you're on mute. I'm sorry.
How's that?
There you go.
All right. Let's see here. So, good afternoon, distinguished members of City Council, health and commerce officials, and other visitors, and thank you for taking the time to hear our concerns. My name is Jeffrey Miller, president of Jeffrey Miller Catering Company and founding member of PEP, which is the Private Event Professionals of Pennsylvania. We're a group of about 200 plus caterers, venue operators, bands, photographers, decorators, and other event professionals. As Commissioner Rashid has mentioned today accurately, the hospitality industry is the hardest industry that's been hit. And then the wedding industry is actually the hardest hit industry within hospitality. Not unlike restaurants, we can't we can't serve 25% or 50%. We can't do little takeout shops. No one's doing takeout weddings, so we're almost completely shut down. But I'd like to take a few minutes to tell you about our current precarious financial position and the damage that Philadelphia's ban on weddings has caused us and continues to cause. The mistaken view of the city regarding the benefits of shutting us down and the help we are seeking. People plan a 200-person wedding because they have 200 close friends and family. So a 50-person wedding just doesn't do it for them. So with a 15 to 20% capacity limit for weddings, basically means we're just about completely shut down. And if we do a few weddings for 40 or 50 people, we do it to allow clients to use their deposits so we don't have to cancel, risk getting sued. As the prior respondent spoke, people are angry when you can't do their weddings. And when they want their deposits back and we've spent them, they sue you. We have about 20 lawsuits going on right now. It's horrible. So these 20, 40-person weddings don't help us at all. So when the city says you can do weddings for 15 to 25%, what they're really saying is no weddings in the city of Philadelphia. We operate 2 venues in the city, one of them and several in the suburbs. At our indoor facility, the Rack Club of Philadelphia, we lost every single wedding booked from March 2020 to the present. At our outdoor venue, the Swedish Museum, we lost 90% of the events in the same time period. We furloughed about 3/4 of our staff in 2020, and we've lost several $1 million. And that's after the PPP money, which we got. Many of my colleagues in the city have fared much worse. Of course, when the wedding industry is shut down, caterers and venues are not the only casualty. We have working class waiters, cooks, bartenders that are also thrown out of work. And when a city wedding is canceled, the event planners, the photographers, the DJs, the florists, all those guys are losing their jobs as well. And then the hotel rooms that would have been filled by guests are now sitting empty, with the cleaning staff and other staff losing their jobs and work. We've calculated that of the 38,461 weddings that normally take place here in Philadelphia, it's generating tens of millions of dollars a year in revenue for the city, with over 100,000 hotel rooms alone. So the big fallacy, as Claire said, keeping weddings shut down, is that by shutting down weddings, residents are actually less safe. First of all, over the winter, the city saw a huge increase in case counts, but almost no weddings since we're all shut down. So people are getting sick at home, as several people have mentioned, at school and at house parties, but not at weddings because there were none. And then again, as Claire mentioned, people who can't have their weddings in the city might postpone one, so many have, but many also just leave the city. And I know very firsthand because we have suburban properties that are picking up the weddings from our own city properties, but also from other hotels, from other venues in the city that are not able to open up. So again, as Claire said, these city residents are still having their weddings and the friends and family from Philadelphia are still attending. At the end of the night, they drive back to the city. And they're no safer than getting married in the city, but the city workers lose their jobs. The city loses the event revenue and the wage tax. Again, as Claire mentioned, when people have events out of the city, they can't do them safely under supervision. As we can provide as licensed caterers, they're just doing whatever they want. There's no health checks, there's no contact lists, there's no sanitizing stations, there's no masking requirements. All that's out the door. So in summary, shutting down the wedding industry in the city makes the city no safer, only poorer. Our request is to let folks get married in the city and give us 50% capacity now. But more important, we ask the city to provide a plan to reopen, much as they did last year with the color coding. Last year, when there's no vaccine in sight, there was a reopening plan. Now with vaccines becoming widespread and hospital stays dropping, there is no plan. We know that if we were at, say, 20% hospitalization, ICU capacity, and 50% vaccination rates, the city would probably allow us to reopen. So there must be some metrics that will allow us to reopen. All we're asking is that the city make these metrics public so that people can plan accordingly. There's no need to keep them a secret. If couples are told when they'll be able to have weddings and at what capacity they can plan, right now couples are canceling weddings in June, July, and August because they have no guidance. If the city allowed weddings at 50% tomorrow, we'd have no weddings for 2 months. To keep our summer weddings now, we need to provide a reopening plan now. New York, Connecticut, Chicago, and California, many other cities and states have plans. We do know that there are some metrics in the mayor's office that allow us to open. Again, don't keep them a secret. Write them up and give us a plan. Lastly, a question for Dr. Farley. He mentioned case counts are up. I'm not a doctor, obviously, or I wouldn't be cooking for a living. But I was wondering if we're looking at hospitalizations as well. There are some folks who are saying that this is going to be a chronic situation, but with vaccines. And as I understand, if you get COVID, but you have a vaccine, you get a much lower case of it. You don't go to the hospital and you don't die. And I guess that's the issue. Just as if you get the flu, you usually don't go to the hospital, you usually don't die. So case counts may be up, but maybe that's going to be chronic, but hospitalizations and deaths will not be. So possibly we should look at hospitalizations as the metric and not just case counts. Thank you, and I'm happy to answer any questions.
Thank you, Jeff, for your testimony. We'll wait till everybody else testifies to see if there's any questions from council. Ed, do you want to just state your name for the record and then proceed with your testimony?
Good afternoon, Councilman. My name is Ed Gross, and I'm the Executive Director of the Greater Philadelphia Hotel Association. I'm here today to share with City Council the impact of the pandemic and the city's restrictions have had on our hotels. Thank you to Councilman Squilla and Councilman Bass for holding this hearing today. No other industry in Philadelphia has been more hurt by the pandemic than its hotels and the hospitality industry. According to recent numbers from Tourism Economics, in 2019, our occupancy rate was 76.3% and fell to 30.9% in 2020, a 59.5% decrease. This resulted in a loss of hospitality jobs from 79,800 to 48,200, a 66% decrease. Hotels presently are at 49.7% loss of jobs since 2019. Of all the jobs lost in Philadelphia, 40.5% were hospitality jobs. So I'm here today to advocate for the 50% of Philadelphia hotel employees that we have not been able to bring back yet. From housekeeping and banquet staff to guest service agents, these employees are treated like part of the family, which is why they receive competitive wages and extensive benefits. They just need City Hall to ease restrictions and do more to encourage visitors to return to the city so they can get back to work. Our business is slowly returning, and so hotels are finally reopening. And as members of large nationwide organizations, our hotels have partnered with medical experts to establish strict operating procedures to prioritize rigorous health and hygiene guidelines for the consistent safety and protection of guests, meeting attendees, and employees. Unfortunately, City Hall has taken a unique approach to pandemic restrictions, as none of the surrounding counties or cities we compete with have as onerous restrictions as Philadelphia. Other jurisdictions have been safely holding business meetings, weddings, and even conventions with no increase in infections, but Philadelphia has chosen to lead from behind. Our business model requires weeks, if not months, of advanced lead time to book business and carefully plan events. This lost business hurts our employees in food and beverage, housekeeping, front desk, audiovisual, valet parking, bell staff, and more. The long-term lack of future business has severe consequences on the city, as the multiplier effect of the hospitality sector contributes to the local tax base that supports essential functions. Please help the city bring visitors and revenue back. The hotels have sacrificed so much during this pandemic, and we need City Hall's affirmative assistance to establish our recovery by ensuring we can compete on a level playing field with those outside the city and in neighboring states. Thank you for your consideration on this important matter.
Thank you, Ed, and appreciate it again. Before we go with any questions, we're going to have Jay testify. If you could just hang in there for a little bit longer, and then we'll go ask questions after that. Jay, just state your name for the record and proceed with your testimony.
Thank you, Mr. Chairman. Good afternoon. My name is J. Nathan Basil. I am the Vice President of Mayfield Social Club, a private social club with more than 1,000 members. I'm also the chair for the Outdoor Dining Committee of the Midtown Village Merchants Association. We currently represent 23 restaurants in the 13th Street corridor of Center City. I also sit on the Restaurant Advisory Committee. I'm here to speak on Resolution 210201, and I thank the joint committees for taking this time to listen to all of our stories. I will be direct. It has been a pleasure and a true joy to work with many of the city's agencies. When was the last time you heard someone say that they enjoyed working with L&I or the Streets Department? Well, I'm happy to say that it has been a true joy. Commerce, Managing Director's Office, Streets Department, Fire Department, and L&I have all been a pleasure to work with, and we have felt supported as an industry by these agencies. Unfortunately, the same is not true for the Health Department. The Health Department has not only been a complete train wreck to work with, but we have found them to be combative, disrespectful, and completely ignorant to the needs of our city's restaurants, and quite honestly, the financial stability of Philadelphia. I would like to quickly remind the committee members that as an industry, restaurants pay the highest taxes in the city. When we figure in U&O tax, alcohol beverage tax, which is 10% on every drink, and the sugary beverage tax, not to mention all of the other licenses and fees. It is easy to see why Philadelphia is always included on lists of the least business-friendly and highest taxed cities in the nation. I know time is short, so I will be brief by offering an excellent example of what it has been like to work with a completely dysfunctional health department. After Governor Wolf announced that he would ease some restrictions on our industry, including the curfew, food requirement, and other minor changes, we had our weekly meeting with representatives from the several agencies I mentioned. While we were all ready to discuss the governor's changes, the health department flat out refused to discuss them. They stated they were, quote, still trying to understand the governor's orders. The advisory committee reminded the health department representative that this is why we exist, to help them understand it and how it affects the industry. After about 10 to 15 minutes of discussing the fact that they did not wish to discuss it, I pointed out to everyone that in the time we discussed not discussing it, we could have discussed it. This is par for the course for this agency. They absolutely refuse to listen to anyone but themselves. As others have testified, the same is true with the so-called HVAC requirement. I apologize for that. There we go. The health department ignored virtually all input on how the health department was measuring airflow. They even ignored the HVAC union leaders who were brought in by the mayor's office. No one's professional opinion matters to the health department under Dr. Farley's direction. By the way, even though the advisory committee has never endorsed or supported many of these restrictions, like this discriminatory and failed HVAC standard, this has not stopped Dr. Farley from stating to the press, as he did just here, that these policies have been developed with input from the restaurant industry. He neglects to say that we were all ignored. Since the governor's announcement, we have constantly been trying to explain to customers how the changes will not apply to Philadelphia. This only further angers our customer base. Between 40 to 50% of the customers in Midtown Village are residents of New Jersey, Delaware, and the surrounding counties, all of which have more relaxed restrictions than Philadelphia. We are the dark hole in the middle of a more open region. There are no walls around the city. People come and go from the surrounding counties with no restrictions. So why are we repeatedly subjected to less than the area around us? Also, the department's short notices on changes have caused restaurants to have food spoil and otherwise be lost as a financial loss to the business. These obstructionist attitudes have further harmed the hospitality industry more than any other sector of the Delaware Valley. We are losing. Philadelphia is losing to our surrounding regions. The health department is causing us to lose. Finally, I want to be clear. No one is asking for unsafe policies or procedures to be put into place. We have all endorsed following CDC guidelines. We fully support the Commonwealth's guidelines. The restrictions that continue to be placed by the Philadelphia Health Department on Philadelphia businesses is harmful to our economy and does not help with the health and issues revolving around COVID. It's all fueled by nothing more than ego. We look to our elected officials, all of you, that would be to be Solomon in this. We need you to step up and be the cool, clear voice of reason. You need to do this. You need to be the elected leaders we chose and lead us through these issues. We need you to help align Philadelphia with the state, which will help eliminate confusion and put us on equal footing with the region around us. On a side note, just in how the health department has dealt with the COVID-19 situation in general. I'm also a person living with HIV, one of those that was deemed ineligible to get the vaccine in Philadelphia County when other HIV individuals in the state could get it. That was discrimination, period. Between that, the Philly Fighting COVID scandal, the cancellation of more than 30,000 vaccine appointments due to a health department error, and this failed HVAC policy. Do you really think that any of us trust the health department in the city? Certainly not from anyone I've spoken to. How many passes does the health department get? We need council to help find a way to fix this so that Philadelphians are, again, not left on the losing end of this pandemic. I thank you, and I'm happy to answer any questions.
Thank you, Jay. Thank you for your testimony. Are there any questions from any members? All right, seeing none, I think a lot of the members have heard this, obviously, and know what the concerns are, and we need to continue to work with you and your input to make this happen. So, Mr. McMonagle, will you please read the title of the next panel?
Yes, our final panel consists of, and I apologize ahead of time, Mercy Mosquera from Tierra Colombiana Restaurant and Bar, Dave Goldman from Urban Village Brewing Company, Jason Evans from the Independence Business Alliance, and Randall, again I apologize, Razik, Managing Director of the Tavern Group.
I would just go with Randall on that one. But all right, let's start with the first person. Just state your name for the record and then begin with your testimony. Thank you.
Mercy Mosquera from Tierra Colombiana Restaurant and Mixto Restaurant in Center City. Good afternoon, everyone. And thank you so much to give me the opportunity to express ourselves and how we feel. We are 31 years in the restaurant business. And for all these years, we are creating a lot of opportunities of jobs. We have hundreds of employees, in these years. It's been very hard for us the last year and having so many problems because of the pandemic. We do believe and work. We do, usually we work more than 15 hours per day, 7 days a week. Tierra Colombiana is not just a restaurant. It was a nightclub, bar and a nightclub, which the nightclub, it's being closed for more than 1 year. And the same as the bar. The restaurant, it's been working. I have the whole experience of been working since March 15, 2020, every day, working more than 15 hours, trying to create ideas, trying to work and make sure that we don't have to close the business. Unfortunately, Mixto restaurant was closed for more than 5 months. We did open last year in August, and then we have to close again 2 more times. The reason that I would like to say this is it's not just about how much it's affecting to the economy of these businesses, also how many jobs, how many employees we have to lose. We used to have more than 150 employees. Right now, it's not even the 50% of them back with us. And I do feel that it's time for us to come back and, like you say, you know, with ideas, with new strategies. But I do feel that restaurant businesses are being affecting, and we don't understand why. We don't understand, you know, most of the regulations and the rules are for restaurants. The doctor says that, you know, for sure they know that the pandemic or the numbers are going up since we start with the 25% or the 50% of capacity. But you just hear from 2 other businesses people that weddings are not happening in Philadelphia, but they are going out of the city and they are coming back. What is happening with those cases that maybe they are, you know, coming from New Jersey or from the other cities with the COVID and helping increasing the number? Why we are pushing our customers going out of Philadelphia? Why we are forcing to lower the economy in Philadelphia and going, you know, somewhere else and help the economy and help to get better? Tierra Colombiana creates so many jobs, and now who is helping us to, you know, stay up? Who is supporting us? And probably most of you think that with, you know, the economy support, the 2 loans that, you know, thank God we are one of the ones who receive those loans are enough support. No, it's not. What we are asking right now is let us work. Let us help to Philadelphia. Let us, you know, to go back and continue with our businesses. We need support to not just close the doors after 31 years, working so many hours, so many days, so many years. And just because we don't have a good, probably strategies, and maybe because we don't have a good communication between the health department and other members, other, you know, groups of people who are supposed to organize. Restaurants are paying the consequences. Restaurants are closing every day. It's so sad when you walk around the city and see those small places that probably they opened just a month before or a year before the pandemic close. It's so sad that, and I'm gonna just, you know, share something with you. Yesterday, I was working in one of the restaurants, Mixto, and customers are calling saying that they wanna make a reservation for 8 people or for 10 people. And when you tell them that we are not allowed, that 4 people are max indoors and outdoors are 6 people, they insult us. They treat us like we are liars, like probably like we are lazy and we don't want to work. Maybe because they don't know the regulations from the city and the health department. And what they say is that, oh, thank you anyway. I'm going to, another to New Jersey or probably outside of the city or somewhere else. That's a big loss for us. We are losing everyday customers. They want to go out with family. They want to go out, for a birthday, for any type of event. And we have to say no. And we have to let them to go somewhere else. So we need to work together. We need to support each other. We need to stop wasting time. I am part of these meetings that we have, I'm not sure, probably more than 2 months, 3 months. And we are just, going around with no solutions because our ideas are not enough. Restrictions are very hard for most of the businesses. No solutions. So what's going to happen? We have the vaccines. Our employees received the vaccines. I did. I think we comply with most of the rules and regulations. What else we need to do? It's not just about the restaurants. It's not just about if we are doing everything in the restaurant. It's also our customers. It's also understanding that doesn't matter if I do everything what I have to do in my business. What about other businesses that are, doing whatever they want? I am a witness of North Philadelphia. Tierra Colombiana is located in North Philadelphia. And I'm a witness of my nightclub is closed, but more than 12 or 15 nightclubs in North Philadelphia are open and working as a nothing just because probably no inspectors or no health department or nobody's going in check. Oh, I hear that because inspectors, they don't work at nighttime. So these businesses are working, selling alcohol until 1, 2, or 3 o'clock in the morning. Underground places are working every weekend or maybe every day. And illegal places are doing whatever they want. But us, as a business, and we, and we want to work, and we are working with the city and the health department, we're still with the 50%. So solutions, I think the best way to look for solutions is like this meeting, like today, getting together, coming with new ideas, but being agreed, because if we are disagree, we are not going to find a solution. We need to be together to help the city economy and businesses economy. We need to support each other. And we need to really look for good solutions. But now we cannot continue 2001 wasting time. This is about economy and businesses. And I do understand that 14% of the economy in Philadelphia comes from restaurants and food services, as hotels or catering. We lost the nightclub, we lost the catering service, and we are trying to survive as a restaurant. So please let us to have more capacity indoors. Let us to work with 75%, and let's put some extra requirements for customers, not just for the business, also for customers. And I think that can be, a little help. Thank you so much.
Thank you. Appreciate your testimony. We'll try to hold all questions till everybody testifies.
Dave Goldman, please.
Am I up? Hello?
Yeah, yes, you are.
Okay. Thank you very much for allowing me to testify today, and it's been a very informative meeting so far. I'll try and be brief. I think Melissa, Avram, and John really hit upon almost everything every point I wanted to make. You know, we're at Urban Village. We're a brewery with a brew pub restaurant in Northern Liberties.
Excuse me, Dave, can you please state your name first for the record?
I'm sorry, Dave Goldman. I'm one of the owners of Urban Village Brewing Company in Northern Liberties. So obviously, you know, like everyone else on this call, it's been quite a challenge for us, and we've been doing everything we can to work within the city's guidelines. In particular, where they've been very challenging, especially as it relates to indoor dining. One segment of the industry that I might want to call attention to are restaurant themes that are bar focused. So our brew pub has a large bar in the middle with seating around it. With the existing restrictions of 6 foot separation and tables of 4, if every table of 4 had 4 people and every table of 2 had 2 people, the most we could do is 36% occupancy. I think we calculated, and I have to imagine there's many other themes like us, that just because of our layout, having all these layers of restriction, it's almost creates an impossible standard. We tried to participate in the HVAC program. We had somebody out. They advised that, I mean, it would have been a fortune to replace our entire HVAC system. We're located in a mixed-use building. It just wasn't even something they would have even proposed. They had some ideas, but they needed to run them past the health department, they said. You know, they followed up several times and didn't receive callbacks, and then I followed up with them, and then eventually fizzled out. And in many ways, I just let it go because we don't even have the ability with the other guidelines to get to 50% indoors. So I would just ask the health department and council to consider that when there's just too many restrictions, it just becomes an impossibility to comply or to effectively operate your restaurant, I should say. And in the end, if we're so different in Philadelphia than all of the neighboring geographics, it's really not effective, I don't believe, because I think as everyone has stated, you know, while we can't pick up our business and leave Philadelphia, our customers can pick up and go elsewhere, and they're doing it. So I don't know that we're creating a safer environment one way or the other. I think we're just telling customers to not come here if your group's kind of big or you want to sit at a bar indoors or things of that nature. Just go elsewhere and do it. And that's what they're doing, or stay home and have it at your house where it's less safe. So just as a matter of efficacy, I don't believe we're getting the outcomes we want. I don't believe we're seeing better COVID outcomes in Philadelphia than the surrounding areas by way of our owners' guidelines. So I think it would be easier for us as business owners and our customers if our guidelines were the same as the rest of the state to eliminate confusion and to give everybody the opportunity to thrive at their businesses after we've all been through so much. So that's all I had to offer. Thank you again for your time.
Thank you for your testimony. Ms. McMonagle, please read the next testifier.
Can we please have Jason Evans of the Independence Business Alliance?
Thank you. Good afternoon, Chairpersons Bass and Squilla, council members, commissioners, directors, business owners, and citizens of Philadelphia. Thank you for your time today. Before I begin, I would like to know if there is anyone from the health department currently on this call. Just say hello, I, anything.
Is Dr. Farley still present? I know the commissioner's still here. I see Commissioner Rashid.
Chairman Squilla, Dr. Farley had to jump on another call real fast.
Justin's
yes,
here.
Sir.
This is Justin from the Health Commission. The Health Department is on the call.
Great, thank you. I would like to speak to you today, not as the Vice President of the Independence Business Alliance or LGBT Chamber of Commerce here in Philadelphia, but instead as a former employee of one of the bars here in Center City. I applaud the efforts of those who have helped navigate this pandemic thus far, including council members, including Alan Dom's office, the Streetery Group, Josh Stratton Rayner, Mike Carroll, Kristen Del Rossi, and many, many more. Their efforts to work with the businesses and listen to the businesses in the city has been transformative in navigating the pandemic safely. It is my hope that more of us can be heard as to ensure the decision-making positions in the Department of Health to understand the full effect of some of the restrictions placed upon the hospitality industry. While I'm not a doctor, nor do I have any expertise in the area of public health, what I do know about is equity and the lack thereof. We have statistics and data from the PRLA, for example, on how marginalized communities, especially communities of color, have been disparately affected by many restrictions to small bars, restaurants, and other hospitality businesses. What I have noticed, in my opinion, is a lack of equity when it comes to businesses that are open and have large capacities in their establishments as permitted by the City of Philadelphia Department of Health. For example, at some point around May of 2020, grocery stores began to allow unlimited access without any type of count or restrictions. From what I noticed, there were no restrictions of any other kind other than mask wearing, which was not being enforced. As I continue to carefully navigate the city, I would visit large businesses as needed, such as Walmart and other stores, rarely with any capacity restrictions and rare mask wearing enforcement. Then I look at bars and restaurants. I feel like these establishments have been faced with the brunt of the restrictions anytime the number goes up throughout this entire pandemic, and I'm not sure why. When I saw recent restrictions being lifted, such as the business meetings allowing catering indoors, I struggle to find the difference between that and being in a restaurant. When I look at the big picture here, I hope someone can explain to me how some indoor eating type events like business meetings are permitted with people from different households, but restaurants cannot do the same. These restaurants and bars have been made to enact new policies like separation plexiglass, plastic curtains, face shields, in addition to masks, and most importantly, to have to pay to have their HVAC system evaluated and upgraded, costing massive amounts of money that these restaurants just do not have at this time. Now, when you look at these HVAC requirements for bars and restaurants, I ask, how is this necessary when schools were about to open with box fans and windows? I understand the need for safety. I understand the need to cautiously reopen the city and have guidelines in place. What hasn't occurred is a greater support for those who work in the hospitality industry, which is one of the keystones to this city. Without this industry, there will be nothing left for tourists and visitors to come here for, essentially decimating the city's tax revenue. I'm not saying to throw out medical science, but what I beg of you is to work with the other departments in the city, work with the communities, work with the business owners to find a common ground as a path to reopen instead of hardline guidelines bestowed upon bars and restaurants, such as the cumbersome and excessively expensive HVAC requirements. As we have heard today, many of these businesses have not been heard by the health department, and we need a way to do so. Streetery, L&I, and our council members have worked with the Chambers of Commerce, the PRLA, and directly with the businesses, and it has helped along this process all the way. Why can't the health department do the same? So again, I ask someone in the city to explain to all of us, where is the equity? If you're going to enforce rules for one group of people like bars and restaurants, please do it to all groups where people will congregate. This means schools, grocery outlets, big box places, in addition to the already massively regulated bars and restaurants. Help us save this city together. Thank you.
Sean, you want to read the next testifier? Next person can please proceed and just state your name for the record.
Yeah, Randall Razik.
Hi, everyone. Thanks for the opportunity to speak today. I'm a little late to the game, but I'd like to echo, and first of all, I'd like to thank Jason, Jay, Melissa, Abram, John, and Mercy for really bringing to the table, what I think a lot of us are feeling. I operate 4 businesses, 2 of which are open at partial capacity. We've lost millions of dollars in this last year, not to mention the hundreds of thousands of dollars that we've paid out of our businesses to support our employees. The number of employees that we've lost who literally live week to week, month to month. And trying to work with them to keep their schedules going and keep our schedules going and keep our businesses operating. We're operating probably at around 50 or 55%. It's growing every week because of warm weather. We have greater capacity to serve outside. Outdoor dining will not save restaurants.
specifically designed where, a lot of people spend millions and millions of dollars to create beautiful environments for people to come to. We're really at the end of our rope with this. And then, to feel, my message, I guess, is that we feel a little singled out. We've spent a lot of money and spending a lot more money to redo our entire ventilation systems. And it seems like we're the only ones in our state or in our region or in our country that are being required to do that. It's a significant hardship. And that's, it's as simple as that. Restaurant people are really hard workers. They're hustlers. They were able to evolve very quickly. We don't leave the office at 5 at the end of the day at 5 o'clock and say, oh, I'll finish this tomorrow. We get things done, one table, one dish, one day, one shift, one drink, one sandwich, one order of French fries at a time. And that's our world. And, it's, we're in a really difficult place. And I would ask people to look beyond our region, look at other cities that are thriving, that are a little more open than us. We all know other people that operate other restaurants in other places, whether it's in Colorado or California or Florida, God forbid, we say Florida. But, these are people that, we talk to and they're like, well, geez, what's it like to operate in Philadelphia? It's very different, So anyway, I would encourage you to look beyond, where we are and look, what other people are doing and how their issues and how their rates are and what their activities are. Anyway, so that's really all I have. And I appreciate the opportunity to speak out.
Thank you for your testimony, Mr. McMonagall.
Excuse me. That's it for our testimony, Mr. Chairman.
Okay, thank you. Is there any other questions from the committee to any of the panelists? All right, seeing none, I want to thank everybody for testifying. It's important. I will review all this information again with the Health Department and my co-chair, Councilmember Bass. And, any other information that you want to email to us and send us to us, we'd be happy to forward that over to Health. So thank you all for your time and efforts. And, hopefully as we process through this, we'll get to a point where we could make everybody whole. So thanks again, everyone. That'll end our hearing. Be safe, everybody.
Thank you, Mr. Chair.
Thank you.
Thank you.